having social prescribing in your toolbox, really, really useful thing to have. So do kind of carry this forward and think about it. You know, when you're going through the mental health case, when you're going through the back pain case, when we're talking about pain management. You know, yoga is one of the things that NICE recommends for management of non-specific lower back pain. You know, so this is all very, very applicable stuff beyond just its benefit to you having had a very nice week. I've been stressing my students to the nines, telling them all the terrible things that are happening in the future. You've had a very relaxing week. If you can manage things non-pharmacologically, there's a whole host of benefits, both in terms of the economics, both in terms of the social benefits, also carbon footprint, which we've already mentioned. So this is a really useful thing to have in your toolbox.
I've really enjoyed this week. I think going into it I wasn't really sure what to expect because I didn't really have much experience with like breathing techniques and meditation and things like that, but I've definitely found it quite eye-opening. I found that it's definitely made me feel a bit more relaxed. It's quite good at clearing my head. Obviously with medicine being quite an intense course, I think it's really important to have to take time for yourself and to look after your own well-being. You know, you need to take care of yourself before you can take care of others.
Yeah. So social prescribing, this could be a really good thing to tell our patients in the future.
Sky breathing, like it's really relaxing, and again, like it helps me improve my sleep as well. So maybe like 10 minutes before bed, I can just do that and then improve my sleep quality as well.
Thing that I've benefited from is that my sleep has improved really a lot. Like even in the short sessions that we have each day, after a bit of meditation, I really feel so sleepy. It's like it's really easy to get into that calm and relaxed state that sort of preps us for good sleep.
You like the most out of this, which you can implement in your daily life?
I think there's definitely a time and place to sit down and sort of think about your own feelings and how it's affected you, what you've been through, and is there anything you need to properly deal with? Because I think it's quite easy to put that to your back of mind when you do need to deal with it, and it will pop up later. Is over-prescribing of medication, and this is something that I could definitely recommend in the future.
Holistic healthcare and things like that are definitely something that's going to be really important to the NHS going forward. Obviously, as we know, it's under a lot of pressure at the moment, and it's really important to encourage patients to take responsibility for their own health. Sky breathing and the meditation that we practice has a massive impact on both physical and mental health.
Do you think a lot of like the reflections from the project have given me a lot of time to kind of think about how I want to like kind of manage my life moving forward, and then it's given me some really good techniques to kind of deal with the burnout should I feel that, whether it's academic or just life responsibilities.